When they have a knee problem, they let it go. Do not prescribe calcium supplements for people who are below the age of 50 or 45 because it's just knee problems, back problems which are in a smaller stage when it is not hurting you so much. It's better.
Pregnancy, அதுக்கும் நம்மளோட knee pain இல்லனா bone healthக்கும் ஏதாச்சும் connection இருக்கா?
Running is okay in pregnancy, jogging is okay in pregnancy. These were myths that are wrong. Treadmill வச்சு நம்ம நடக்கணும் வேலை செய்யணும்னா அது முடியாது. We need to concentrate on one thing, right? Where there is a gym every 5 minutes. So everybody is working out and all the gyms are busy. Parents and grandparents need to make sure they don't get too much of sugar, too much of chocolates, too much of... At 55, 60, whether they do knee replacement or not, they are not very bothered. So they are like, no, I'll go, what? I don't have much life left. But on the time number treat pannana, we will prevent. Postmenopausal is when you actually really need to work on bone density. But in reality, menopause, it is not such a big problem.
It is not.
It is not.
JFW Health podcast, your one-stop destination for all things when it comes to understanding your body. நம்மளோட பாடியை பொறுத்த வரைக்கும் நிறைய கேள்விகள் இருக்கும், அதுக்கான பதில்கள் நிறைய இருக்கும் when you look to social media, when you look to the internet. But when the answers come from an expert, that is where the magic lies, and that's where we are equipping ourselves with information. So அப்படிப்பட்ட ஒரு platformல we're very happy to welcome Dr. Kunal Patel, of course, senior consultant, orthopedic and robotic surgery, Apollo Hospital, Greams Road. Thank you so much for joining us, Dr. Patel. Absolutely lovely to have you here because when it comes to the world of என்ன சொல்றது orthopedic அப்படின்ற ஒரு ஸ்பேஸ்ல வந்தா நிறைய பேருக்கு வந்து எவ்வளோக்கு எவ்வளோ இன்ஃபர்மேஷன் கிடைக்குமோ அவ்வளோக்கு அவ்வளோ கம்மி because we want to understand our body but the questions are too big to be I think consultationல முடிகிற மாதிரி. So I'm going to ask you the big question.
Okay.
So before somebody walks into a consultation with you, what is that one thing that you want them to know?
If they come into my room, first thing I would like them to know what problem they have and be confident that whatever problem they have, it will get solved and that they can solve it themselves and we will help them do that.
When we introduced you, we said robotic surgery.
Yeah.
These two words in combination, I think, has the curiosity of the entire world because when we say robotic surgery, ellar manasliyo there is an excitement when it's somebody else, but when it's a surgery for myself, robotic surgery அப்படினு சொல்லும்போது ஒரு சின்ன பயமும் இருக்கும். So can you throw a little light on what robotic surgery means?
So idilla enna robotic surgery doesn't mean that robot is doing the surgery.
Okay.
It's a whole new thing, but what happens is robot is only assisting us in doing the surgery. நம்ம என்ன பண்றோம் முன்னாடி நம்ம ஏதோ surgery பண்ணும்போது we used to do it manually by using instruments and guides. Now we use a computerல நம்ம we feed in the data, we have to feed the data, and நம்ம computerல போட்டு we want to do it this way, we want to do it that way. I'm talking about orthopedics. Every robot has different, there are fully automatic and so number robot in Nana, we will put it there and then the robot will just help us achieve what I want to achieve with the highest accuracy possible.
Okay.
Now with the advent of AI and with the advent of newer things, I tell you one final thing I will tell you is that there is no way that the human touch will not be required. At least in the near future, I don't see that happening even with AI. The human touch, because what experience, AI you can put in 100 things and you can say let's do it this way, do it that way, you don't need the human. But the human touch is very, very important because the feel cannot happen. What you feel this wood, you feel the bone, you feel the body, you feel the muscles. That can't be done
Through a robot,
no.
Okay.
And every body is different. So this thing, and in conclusion I would say a robot for today, it only helps in enhancing the accuracy and that way it will enhance the outcomes. It makes the surgery a little bit faster and it could make it a little bit minimally invasive, but the surgery is being done by your doctor, not by the robot, and that's very, very clear. And so it is just that as things go, it will be more automated, more things will be done by the robot, but final things that have to be fed in and final things have to be done by the doctor, because even with the fully automated robots which are there in other branches, they're still sitting, they're looking on the screen and they're doing it. The arm is moving, but his hands are doing the joystick, right? What to do, when to cut, which to cut, where is what, has to be done by the doctor.
Okay, so when you trust your doctor, the robot is just an extension?
Just an extension, and it's like it's like something that helps the doctor to achieve a better result for his patients.
Fantastic. I think that calms a lot of us because in our minds, it's very like a futuristic world where, like you said, there's a robot cutting you open and then there is
Yes.
nervousness that sets in. But like you said, as long as it's an extension of the doctor, once you trust your doctor, then
Yes.
the rest of it just flows.
Yes.
எல்லாருக்குமே இப்போ முட்டி வலி ரொம்ப ஜாஸ்தியா இருக்கு, especially in comparison to 20 years, 30 years back. What is happening in our lives that's increasing our knee pain?
So there are multiple factors. One of the things is that reality today, the number of people playing sports, the number of people involved in other activities like physical activity is way more than what was about 20 years ago, 20 to 30 years ago, because everyone's working out. Look at it. Gym na evlo gym irukum next to you everywhere. There is a gym every 5 minutes.
Correct.
So everybody's working out and all the gyms are busy. So everyone's working out and playing sport. How many pickleball courts and how many tennis courts are there around the city? So many. So the injuries are higher and not everybody is getting treated with those injuries at a smaller level, at an initial stage.
ஒரு சின்ன வலி வரும்போது we are not
treating it. So on the time number treat pannana, we will prevent later problems, especially நீங்க என்ன சொல்றீங்கன்னா knee arthritis. So that we will prevent. Number one. Number two, this is a good part. People are working out, but there is a negative part. Also, there is a big group of people who are not working out, and people who obesity has also become a problem. So people with obesity also tend to develop knee problems. So that also prevent panla with proper diet and being conscious about our bodies, and because that is the best thing that we have. So and if we prevent these two things, we in a long way we can prevent knee problems.
And the bigger question is, knee problem is the obvious one, but you are meeting so many patients on a daily, day-to-day basis. So what is that one thing that you have seen that was not there 10 years back, but ippo it is a prevalent issue? Neenga on the sports patti sonninga. Anything else?
So what I see is another thing is that as much as people are illiterate, I do see a lot of people who are still, which I would say in this day and age, don't actually pay attention to their small problems. When they have a knee problem, they let it go. Chinna problem indana avanga onnu panna matanga. I'm saying that even arthritis in smaller places, I'm saying tier 2, tier 3 cities. I see a lot of patients from tier 2, tier 3 cities. And I feel these people, the problems with them are increasing more because they are not taking care of their knees in advance and not taking care. Even chinna problem indana ava paaka matanga. Osteoporosis, another big problem. I just brought it up. Osteoporosis is another problem. That means bones are getting weak.
Brittle.
That also leads to knee problems and osteoarthritis in the long run.
So the list is going on.
The list will keep going on. If you keep asking me, it keeps going on and on.
So let me ask you the question that all of us want the answer to, which is bone density. How important it is that we focus on our bone density early on in life?
So the reality, the fact, a lot of people feel that bone density, but let me tell you, in women, post-menopausal is when you actually really need to work on bone density. But in reality, below that, this is the reality, below the age of 50, before menopause, it is not such a big problem.
It is not?
It is not.
Oh, that's good news.
It is not. In people who are eating properly, who are doing regular work, going out, it's not such a big problem. It is more of a problem in the people above 50 and for men above 60. So I personally do not prescribe calcium supplements for people who are below the age of 50 or 45 because it's just not required. Our body metabolism is so good. We are eating right that it's the calcium, the bone is good. It is all these problems happen post 50. And that time it's not necessary that it's only it's osteoporosis, bone weakness, bone density is because of the food alone. But you need to give the right supplements, keep yourself checked, do a DEXA scan every year or at least every 2 years, see where you stand. And this will go a long way, let me tell you, not only knee problems, but in preventing fractures.
Can you tell us about the scan, DEXA scan?
DEXA scan.
What is that and how will it give you an understanding?
So DEXA scan is basically a scan which measures the bone density, or just in layman language, the bone density, it will measure it in the spine, it will measure it in the pelvis, it will measure it in your bones, knee bones, and on the neck. So what this does is, this will it will show what is the fracture risk. So it's a little bit more detailed, and it is looking at different parts of the body for you to understand. So it gives you a score at the end of it. Whether that score, and if it is below a certain level, if it is in the reds, then you have to get treated immediately, and your fracture risk is higher. So yeah, that's why I think that's more accurate
Okay.
than bone mineral density and things like that.
Do also women suffer a little bit more from knee pain? Because எனக்கு தெரிஞ்ச வரைக்கும் in our personal
Absolutely.
circles, we hear the aunts
Absolutely
and the
right.
moms.
Yes.
Is that true?
Absolutely right. So women do have more because they generally tend to have a wider pelvis. So when you have a wider pelvis, the weight bearing to the knee, the joint reaction forces on the knee are very high. So that's why women tend to have more. And the fact remains, which I should not be saying, women in India, tend to be more obese than their counter men that are there for whatever reason. They are not able to go to work out, especially tired too. They're sitting at home. They're not able to work out. They're not able to give enough time to their bodies. And probably those are the reasons. There could be multifactorial, but those are the reasons. The obesity is also a factor for women too.
That's true, because we also understand that there are a lot of times when women tend to prioritize other people, and நம்மளோட health வந்து நம்ம
Ama.
அப்புறமா பார்த்துக்கலாம்
Exactly.
அப்படின்ற ஒரு approach could
Ama.
put
Absolutely.
us in a tight spot.
Absolutely. Every woman in the house, she will be the last to help
Eat.
herself, eat, and do everything. In most households, of course, it's changing now, but still a long way to go to change. And so my advice to all the women is, unless you take care of yourself, you will not be able to take care of the people around you. So first, take care of yourself.
Put on your oxygen mask
Put on
first.
Yes.
Fantastic. That's a great reminder. Also, I have to ask you, when it comes to pregnancy, அதுக்கும் நம்மளோட knee pain இல்லனா bone healthக்கும் ஏதாச்சும் connection இருக்கா?
Pregnancy it is very important, because pregnancy இருக்கும்போது there is a number, there's a child who's being born, and there's a lot of vitamins, there's a lot of minerals and everything going to your baby. So in those situations, usually it is actually traditionally India le nama pathana, there is every group has got their own local ways of treating or taking care of mothers who are pregnant, and so that they don't get deficit. But they don't tend to have more bone problems in terms of bone mineral problems as much. But what they tend to have maximally is back pain.
Okay.
Yes, because
correct.
back pain, what happens is when they put on weight, the back gets strained a lot, and especially after pregnancy. I see a lot of people post pregnancy, when they come after 1 year, because usually the first 6 months they don't have time. Then after 6 months they come, and then they say that they have back pain, and they have which is not resolving. So the reason for this is that the back pain happens because there was so much of weight that was put on, and not everybody goes through these. It is now an exercise routine after the pregnancy. It is very, very important that women go through this exercise routine and lose their weight fast, as well as strengthen the muscles. So when they are doing that, they need to strengthen the muscles, lose weight, strengthen your back muscles, strengthen your core, because you lose a lot of muscle in the core. And that will prevent them from having these problems in the long run.
Actually, when you talk of postpartum, இப்போ வந்து we're in a time where women are either pressurized, or they want to get back to the pre-pregnancy weight, or they want to get back to work. They
Yes.
want to kind of speed through the process
Correct.
for various reasons.
Right.
So, under a process, how do we make it a little more palatable? How do we make it a little more realistic? And is there a timeline? Give us a little light on what the postpartum life looks like.
So I'll tell you what, I'm not an expert in the postpartum part of it, but let me tell you from the orthopedic perspective, okay? Not from a gynac perspective, how long it takes for their stomach to go
Yeah.
inside, how long their waist becomes. I don't have
Correct.
the best knowledge there. But I will tell you, with the orthopedic perspective, I look at toning the muscles, number one. Number two, preventing any joint problems, especially back problems and knee problems. This is what I would look at, and from them to prevent infections in like sacroiliitis or infections in the pelvis. These are the things that I would look at preventing. But if you ask me, the goal that they should have is in the 6 months after 6 months. It's a very long-term goal, so it doesn't strain you. 6 months postpartum delivery, I would suggest that they should come back to their pre-delivery weight. That should be the goal. 6 months to 1 year. Pre-delivery is not easy, but they can manage
That actually gave a lot of us a shock, I'm sure. But I have to ask you the more important question. How soon can you get back to working out? Or, when you have that pain.
How soon?
Yeah.
The next week. As soon as, if you have had a cesarean, it's a different situation. But when you've had a normal delivery, then one next week you can get back. Gradual walking, jogging, those are things which you can start immediately. So, yeah.
So it's not a question of like, don't push yourself too fast too soon. அந்த மாதிரி ஒரு பயம் நம்மளுக்கு தேவையில்லை.
Actually, I'll tell you what, since this is postpartum, let's talk about before delivery, when the people are, how do you prevent putting on too much weight, and how do you prepare yourself so that your post-surgery, postpartum is good?
Think ahead.
Yes, think ahead. So what you do is, when you are doing this, you must do all exercises when you are
during your pregnancy.
When you're in your pregnancy. Running is okay in pregnancy. Jogging is okay in pregnancy. These were myths that are wrong, and they have these things are allowed. So you don't put on too much weight.
Correct.
You don't put on too much fat, unnecessary fat. You're eating right. You're eating healthy and eating the right food. So your body is going through that. Your muscle, because you will be doing weight training, should be done. You don't need to do heavy weight training, but quad strengthening exercises and muscle exercises, balancing exercises, these are very important. So these balancing exercises, if you do prepartum, postpartum, all this becomes much easier. And the week after surgery, you will be able to get back into it and gradually increase intensity. I said 6 months, but see, there is no point in putting a goal for yourself, but as long as you're working towards it and doing what you can to do that, it will make them feel nice, because postpartum, there's a lot of depression, there's a lot of things that people go through. So this, by doing exercise, it gives women that break that they need for themselves.
The focus on you.
Yes, and for themselves. And then when they look nice, they feel good, and then they are able to do well.
Fantastic. I think that's a good takeaway, that what, at the end of all of it, you also have an added icing on the cake to look forward to.
Yes.
When it comes to the lifestyle aspect of it, anytime that we have ஒரு muscular issue, we know that நம்மளோட lifestyle நம்மள கொஞ்சம் bother பண்ணுது, இல்லைனா we have made a wrong lifestyle choice. How much does the lifestyle choice affect our bone health?
Yes.
Does it?
Yes, if you look at alcoholism, it will affect bone health. Drinking too much for long term. I'm not saying drinking little bit. I'm
in
talking
moderation,
about alcohol. Moderation is okay. Moderation is okay. But when people become alcoholics, or people try to, those things do affect bones. Smoking affects bones. So these things in terms of lifestyle. Other than that, if we choose not to exercise, okay, and we choose to have a sedentary lifestyle where we are sitting at, not walking around much. A lot of people in businesses, although they are affluent, some people, as much as people are working out, I told you, there are a lot of people who are still not working out. And that kind of a lifestyle can lead to bone problems. But always after the age of 45, 50, you actually see them appear. So that's why it is so important that in your younger age, between your 20s and 40s and 50s, that you have made your body, and it's a routine in your mind to exercise, that post 50, 55, when actually all the problems could start erupting, your exercise routine is so good that you're able to continue that for your life. And so, it becomes a habit, yes.
What are the few things that you can do? One, ninga exercise sonneenga, so say about an hour every day, or a lot of them suggest 5 hours for the entire week. Make sure that you work out consistently. With regards to our diet, what are the changes that we make? Or sleep, does that affect our bone health?
Sleep does affect moderately. It does affect. So I think 7 to 8 hours of sleep is good, which is what we must try and get every day. But exercise, if you ask me, the number of hours that we were talking about, exercise, I would say at least minimum 3 days you must exercise with 1 hour of workout. And I would say the ideal thing is 3 days of that and 3 days of cardio, where you do a good exercise routine,
heart
where you're actually burning calories, heart rate goes up, because that will keep your stamina good. So if you can do this, it's good. Of course, added, if you're able to play a sport, it is added advantage. But when you play a sport without working out, your chances of injury increase drastically, because your muscles are not strong enough to handle the sport. So when we do it recreationally, if we are playing a sport, we must work out. So you need to give equal time to work out and sport. Yes.
So let's talk about the other side of it, which is the weight gain part of it. Weight gain panna, sometimes our body takes it in its stride. Does it also affect how our body functions, especially when it comes to our bone health?
Yes, definitely. So bone health is a very broad term, but let me say what it will affect. So what happens is, if of course, like if your weight is more, what happens, main thing is, in the long run, especially people who are obese, they do tend to have osteoporosis more than the patients who are less obese.
Okay.
Osteoporosis, I mean by calcium deficit, or the bone gets weak. Plus, with more obesity, your joint wear and tear is much more. So your joints get arthritic faster, injuries are more common. The muscle in reality is actually less stronger in obese patients than non-obese
Somebody
patients.
who's not obese.
Yes. So I mean, so they really, obesity has a lot of issues. I mean, you can go on and on.
Correct.
You can go to diabetes, you can go to cholesterol problems, you can go to heart problems. So there's so much. But in the bone, mainly it is the joint. It causes wear and tear of the joints. It causes osteoporosis of the joints. And of course, around the bones, the muscles get weak.
So definitely be wary and of
Yes,
course
yes. So
expect.
obesity is no.
Absolutely.
No, no.
Absolutely no. Be on the lookout.
Be on the lookout. When you're going there, make sure that you pull back.
Right. When it comes to also our lifestyle, நீங்க சொன்னீங்க about sleep, about our dietary thing. A lot of us have been told that if you take 10,000 steps a day, then உங்களோட health நல்லா இருக்கும். If you know, that is enough exercise அப்படின்னு நிறைய பேர் சொன்னாங்க, or rather சொல்றாங்க on social media that it's the like a golden standard when it comes to day-to-day activity or exercise. Is that really true? Is it
That's
enough?
news to me. Okay.
Because I was going to ask you, what is this magic number of 10,000
So I
steps?
don't know. I really don't know. I haven't
Heard this,
I haven't
okay.
heard this. I haven't heard the social media. But let me tell you my perspective and what I would think is right. It's not about 10,000 steps or 15,000 steps or 5,000 steps, because those 10,000 steps could be over a whole day. It could be about 10 hours you would have gone through. Yes, it's good you've done 10,000 steps because you've done some sort of activity. It's better than being sitting.
Right.
It's of course better than sitting, but let's not keep that as our goal. Steps, because I know everybody talks about steps with these
All of
watches
us have
all around.
watches and
Yes, watches around. We are looking at steps,
Right.
steps. But what we need to calculate is, when we are working out, what did we do? Because that's when your heart rate was elevated. That's when you were working out. That's when your body was actually doing what was required for it to burn the calories and for it to work. So, I mean, I'm not saying it's bad, but it's better to look at when you work out.
So it's not enough. You
I
also
wouldn't
have to
say- no,
supplement it.
You have to supplement it.
Okay.
That is not just enough. I just do this. You have to supplement it. Workout is important. So that there's no two things about that.
So what is the biggest என்ன சொல்றது mistake that you see people make? அதாவது நிறைய நேரங்கள்ல we do things thinking we are doing something positive for our body. For instance, it could be the 10K steps. For instance, it could be someone really pushing themselves at a sport, or in the gym, or maybe a little bit of a diet that somebody is following. What are those mistakes that you want people to understand? Listen, it's 2025. Get your life in order. அப்படின்னா என்ன சொல்வீங்க?
So what I would do is, the mistakes that people make mainly are in terms of diet. They have, in terms of diet, let's go step by
Yeah.
step. So with diet, what happens is, let me tell you really, in the affluent class, they do go to the right people. They get dietitians to look at them, and then they really work on it, and they do
Break down the nutrition.
break down the nutrition. They do a good job, calorie count, what they need to eat, when they need to eat, and they plan it well, and it works for them. But majority of the people, see, I look at all kinds of people. Majority of the people, they are obese or they are fat. They say, I don't eat much. I don't eat this or I don't eat that. But ideally, they are getting nutritionally deficit because they are trying not to eat, but they're never going to lose weight, because they're not following the right path. They don't know what is the nutritional value of what they're eating, and when they should eat, how much they should eat, what is the quantity. So there's a whole science behind. So my advice is, there's a whole science behind food and diet. So when you want to do it, you must consult. Today, it's not difficult to consult somebody, a special dietitian. You must consult somebody. Consult panna pakatla. There'll be so many dietitians. Consult them and follow them. So fun thing is, they will keep a track on your food. Second thing is, you know and you learn what you must eat. And dieting is not a one-day story. It's a lifetime of change. It's for lifetime. You have to change. You have to change the way you feel, change the way you eat, change the way you perceive food. Then you will see the result.
The change that you want
Yes.
to see. So
Now,
that's the diet part of
part.
it.
Now, what about the
Say your exercise part of it.
Yes,
How
let's
much
talk
should you
about
push
exercise.
yourself?
Let's talk about exercise. So, exercise and sport, right? So, a lot of people, you know, you want to achieve. When we start doing exercise, we want to achieve. A lot of people wants to achieve more than what they can. So, my simple suggestion is you must go very gradually with whatever you're doing. Don't try to achieve too much in very less time. And if you really want to achieve a lot, I would say you must have a proper guidance, proper training,
Right.
proper assistance from somebody where you must see how everything is balanced, how your nutrition is balanced, how strong your muscles are, and how you're pushing your weight. So, what happens is, you know, when you don't do these things right, you will tend to have injuries, and then finally, these injuries will take you so long to recover from that it disheartens you in the sport or in the workout or in the exercise regimen that you're going to. So it's very, very important to be doing it the right way.
Patiently set the goal
Slow. And if you don't have a trainer, it's fine, but then go slow. Just go slow, do what you can, do it properly. That's all.
And the other question that I want to ask now, this might be a little personal because a lot of people are also worried when it comes to the kind of footwear that we have. For instance, now we're seeing இது வந்து ஒரு orthopedic shoe, இல்லனா இது வந்து high heels போடக்கூடாது, இல்ல when you're a particular age, these are the kind of shoes that you should wear for your own safety. Is there any
Yes, absolutely.
value there?
Lot of value. So we see something called as plantar fasciitis.
Okay.
Plantar fasciitis pain in the heel joint. Heel la pain varum. But adu number enna the reason enna number footwear சரியா இருக்காது. We will be wearing thin footwear which is without much cushioning.
Support.
And it usually யாருக்கு வரும் இதெல்லாம் people who are standing for a long time, people who are working out, people who are running and then they don't wear proper footwear. It tends to happen to them for a more reason. And of course, there are other problems like uric acid problems or other things which cause this. But so, you know, comfort is the prime most important thing for your feet, especially when you are going to be standing for a long time. I understand you have to go for a party or you have to go outside. You have to social. You know,
You want to look a little nice.
Yeah, you want to look nice. In those days, I'm not saying don't do it, but just keep. You can wear what you like at those points, but you will be only able to do that if you don't have a problem. So in your regular day-to-day off days, wear proper footwear which is comfortable. You wear it which is comfortable. It doesn't, and always make sure they have a cushion, little bit of a cushion, a heel support. Soft footwear is what we must go. Designs are important, but not more than comfort.
I think that's something that we'll remember for a long time. Comfort comes first.
Comfort comes first.
Fantastic. Now let's talk about the other side of the orthopedic world, which is the group above 50,
Yes.
or maybe even a little older than that. Because any time that you meet somebody who is above 50, above 60, there is a general tendency that you ipo vayasaiduchu mutti valila normal. இல்லை வயசாயிடுச்சு இல்லை பேக் பெயின்லாம் நார்மல் ஸோ we see a lot of people taking it as part of their life without actually looking to fix that or identify the issue. Is there an issue? Do we need to reach out to a professional? Do we need a doctor's guidance?
So after the age of 50, what happens is a lot of people in India feel that they have become very old, and then because at 60 people retire, at 50 their kids are kind of getting settled and they are settled, and some of them have gotten married, so they think that our duty is done and they just look forward to one thing, that is their grandkid or what is going to happen. They forget that their own life is important, that they have to, you know, think about themselves and that they have a long life left.
Right.
They have a really long life left, something to look forward to, something that they should plan. Now, in this process, they forget that they have problems like small back problems. It's a very common thing. Vayasaiduchu, ipo enna pannanum? Vayasaiduchu, ipo namba onnu thevilla. Ipo enna pannala? She'll be 55. Vayasaiduchu. So I'm like, you know, you must not think that you're old.
Right.
Ever.
Ever. Okay.
You could be old, but you may be 80, but you need to be healthy. You need to be looking forward to life. You need to be looking forward to new things for yourself. So whenever you have any problems, knee problems, back problems, which are in a smaller stage, when it is not hurting you so much, it's better number treat panna nalladu.
Okay.
Don't let it just go back and just go leave it. இது என்ன இப்போ ட்ரீட் பண்ணுவாங்க யூசுவலா ஓல்ட் பீப்புள் இப்போ ட்ரீட் பண்ணுவாங்கன்னா when the problem is so bad that our nadaka mudiyadu, they can't walk, they can't do regular things, because that's when they see their
Miss out
problems.
on
And yes, they miss out. They don't want to do, they want everything to do for their kids. What about themselves? So they need to take care of themselves, yes.
I think that's a great reminder that, you know what, don't ever think of yourself as old. But at the same time, something that we are told time and again is that the one thing that will make us old is a sedentary lifestyle.
Right.
When it comes to our day-to-day life, yes, we can keep that activity, or running a sonamari, you can walk, you can work out, you can walk, all of that. But a lot of us have desk jobs. When it comes to life in 2025, the large population are seated for எவ்வளோ மணி நேரம்னு கூட நம்மளால சொல்ல முடியாது.
10-11 hours அப்படி இருப்பாங்க.
So, does that affect us? And if it does affect us, what are the preemptive measures that we can take?
So sedentary lifestyle is in businesses or in offices, in ITs, and those are the kind of people who have sedentary lifestyle. So in the Madari Indana, always if I look at it, I see a lot of IT people because they have back problem and neck problem, most common problem.
Okay.
Because they're sitting
and
they're looking at the computer,
constantly,
constantly looking at the computer. So my one and only advice to them is every half an hour get up and stretch your body. But I'll tell you one thing. Also, IT people do have a tough day.
Correct.
But it's not like they don't have time. Avangalku, they do have time because they are given their holidays. They have that work hours. After their work hours, they do have time to work out.
Okay.
I'm repeatedly saying the same thing: work out, because that is the only way. Number, if they are going to be sedentary, they will have issues in the long run.
Yes. So what can they do? So every half an hour, get up and
so
stretch.
every half an hour, get up, stretch. Whenever you're working, whenever you're sitting on the computer, make sure that you are sitting on the computer for 1 hour or 2 hours or 3 hours, maximum 3 hours, and then you stand up and then you do any work which is standing job. So you can change your tasks. You don't need to do, see, everybody, sometimes we need to talk on the phone, right? You don't always need, you have something on the phone, you have a meeting that has to be done. So time your things in such a way that you work for 3 hours and you're not sitting for after 3 hours, you're standing. You're doing other things. While you're on the phone, you don't need to sit and talk on the phone, you can stand. You can use standing desks and also do your work. So this will improve your steps, like you said.
Right. The 10K.
10K steps that you said, as well as it will eventually help them stay active and help them have lesser problems, like muscle problems.
You spoke about the standing desk, which is going to be my next question. ஏன்னா இப்போ வந்து மார்க்கெட்ல ergonomic chairs, standing desk, there are desks that have like a treadmill below it. So people are getting very innovative. அவ்வளோ innovation நம்மளோட வாழ்க்கையில தேவையா?
இல்ல, அந்த வாக்கிங் ட்ரெட்மில் வச்சு நம்ம நடக்கணும், வேலை செய்யணும்னா அது முடியாது. You need to concentrate on one thing, right? But I think standing desk is a very practical thing, very practical thing. Lot of people do it because when you're talking on the phone, you're doing certain things, you stand, you're more active. See, you know, your productivity will be higher, I promise you, if you are not doing the same thing for a long time. If you change your tasks, you'll be productive there, you'll be productive here. Otherwise, you can't concentrate. Humanly, it's not possible. Your productivity will drop. So it's always good to change tasks. You'll enjoy your work better.
Refresh your mind.
Refresh your mind and you'll enjoy your work better.
So let's go back to probably one of the more simpler questions for me to ask. I don't know how difficult it is for you to answer, but between men and women, what are the biggest changes that you see when it comes to our bone health, or when it comes to the world of taking care of our bone density and osteoporosis? All of this, we hear women have the shorter end of the stick, and a lot of us getting those issues, whereas a lot of the men we already spoke about. So what is the big change, and why is it that women are a little more prone to it?
So what happens is, like I said, the bone problems in women is because of their menopause. During when they turn 50, there is a change in the hormonal balance. And when that happens, basically in our bodies, there's a constant process of calcium deposit in the bone and calcium absorption from the bone. That's a cycle that continues. Now, when there is a change in the hormone, the estrogen hormone, what happens is the absorption from the bone increases and the deposition into the bone reduces. So the bone starts to become weak. So that is why women tend to have more problems. And yes, the real fact is that women are more obese, and obese people tend to have more bone issues. Otherwise, between men and women, there is not much of difference in any other thing except osteoarthritis and bone density. They pretty much stand the same chances in terms of illnesses that they can have.
So, what can we put into our body in terms of food, in terms of maybe supplements in our younger part of our lives, other 20s, 30s, 40s, so that we can prepare for the 50s and 60s?
Again, I'll tell you the same thing. Exercise.
Exercise.
I don't believe so much in supplements, okay?
Okay.
I do believe if you're exercising, all you need is to make sure that your protein content is right. So if you require to take supplements, you just take protein. Yes, there are a lot of people who may go against what I'm saying, this supplement, that supplement, but if you eat right, and eating, there are multiple ways, but what I would say, advice is after an age, certain age, 25, 30, avoid eating food, outside food very often. Today, everybody's
Now
ordering
it's so
Swiggy.
difficult.
It's so difficult. Everybody's ordering Swiggy, everybody's ordering Zomato, and everybody's ordering. India, the biggest thing that we had was home food, which is now going away, and we are following the Western culture, where we just ordering food all the time.
Correct.
That even I'm doing that. I'm not even saying that. But as much as we avoid that, it will help us eat right because our food is very balanced. Any culture you take, their food is balanced. Lunch is balanced. You have vegetable, you have protein, you have carbohydrates, you have everything. So, it is.
Eat that whole plate.
Eat that whole plate. That's fine. Of course, I told you if you have obese problems, you have others, then you can go to a diet program which can help you
Right, to guided expertise.
To guide it, yes.
Now, before we jump into our final segment, we spoke a lot about the 20s onwards, but talk to us about the youngsters. And when I say young, I mean like 5-year-olds, 6-year-olds. What are those active things that we can do? Obviously, working out and keeping them active.
No. They do that automatically.
Yeah, so
you don't need to make them do that.
Adayum Tandi, are there these micro habits or daily small changes that we can make in a 5-year-old's life, in a 10-year-old's life that additional to whatever they're doing at school, they've got their activities. But Adayum Tandi, anything that we can do, and is it necessary?
I will give you what I believe, right? So I do believe, I think that at this age, they are running around, they are doing everything. Nurturing them to just eat or at this age, I'll tell you, yes, one important thing is kids at this age want to eat the wrong food.
That's true.
If we can nurture them from when they are born to learn to differentiate and try to make them eat the right food, parents and grandparents need to make sure they don't get too much of sugar, too much of chocolates, too much of processed food. That because that's going to build their tummies. They're going to build their gastric because that's all getting built at that point. People tend to have a lot of problems in their older life because of the younger days, especially these days, especially the food, because because it's very easy for parents to give them and to give them the food, and it's easy to get processed food than to get the real food, to get food made which they like, and they don't always necessarily like
the healthy part.
So
right.
If we can train them to do that, that will help them in many aspects in their future. But otherwise, exercise, they run around, they do everything. So we don't need to change anything much.
Fantastic.
Yes.
So when it comes to an orthopedic doctor, pala peru varadoda, first step, like you said, quite late when they come in. It is most often for maybe a knee replacement or a hip replacement. Adu varaikkum we try to put off the smaller pains as much as possible. And then we come and then we hear that, what, you need a replacement. அப்படின்ற ஒரு 2 வார்த்தைகள் கேட்கும்போது it really shakes you. It gives you that shock because you think that, okay, இனிமேலேருந்து my knee is not going to work the same way. Just என்னமோ ஒரு band-aid போடுற மாதிரி ஒரு interim solution can be a knee replacement. So what is that entire process? Is it really say a hip replacement or a knee replacement? நம்ம அந்த வார்த்தைகளை கேட்கும்போது பயப்படணுமா இல்லை should we feel like, hey, like this is yet another lease of my knee being at its finest?
No. So it's like this number knee replacement or hip replacement பண்ணும்போது number stage in Nana, we've crossed all the stages. We are in last stage where we have problems in day-to-day life. We are unable to go out and do what we love to do. We are not able to we are not able to live life to the fullest.
Right.
That is when we actually require it. And that point, number knee bending irko, we will be walking with a limp. You may not be as old, but you will look 10 years older. Now, in the time number enna people usually feel that surgery, I don't want surgery, I don't want surgery, I don't want surgery. It's okay if I'm not walking. What is there? Like I told you, people feel that they are old when they are 50 itself.
Right.
So at 55, 60, whether they do knee replacement or not, they are not very bothered. So they are like, no, I'll go. What? I don't have much life left. But number knee replacement, the fear that you have about this replacement is very is not true, because again it's a myth. In a knee replacement பண்ணும்போது the outcomes are fantastic today. They are able to walk within a month without a walker. So slowly they're able to walk. Going for a holiday, 2 to 3 months, you can go for a holiday. So the results have gone way better. Minnadi vali evlo varo knee replacement panna apro. Today our day of stay of hospital is only 2 days.
Because we have all seen our older generation, our grandparents or our grand uncles in bed for a long time, or bed rest situation, and then after that if they want,
They can
avangala edachum rehab panni nadanda okay, illana it's fine. Appdin da நம்ம பாத்துறோம். But you're saying 2 days in the hospital.
2 days in the hospital. The only thing that they will do, they will be taught how to walk. They have to walk with a walker. And I tell everybody, number weed pointe, you will not be on the bed and eat your food. You have to go to the dining table and eat your food. So those are the things. But I tell them, take it easy. 1 month நீங்க ரெஸ்ட் எடுத்தா நல்லது. ரெஸ்ட்னா வீட்ல இருக்கும்போது எக்ஸசைஸ் பிசியோதெரபி பண்ணா நல்லது. அது அப்புறம் slowly they can go out, they can go back to their work, they can go back to doing everything. And the people who are not able to do all these problems, அவங்களுக்கு நீங்க பார்த்தா 6 months 1 year கழிச்சு, they are so happy. Really, it is like, but only this, the problem is number enna, some people feel that we must have a hip with knee which is our natural knee. அந்த மாதிரி வராது. கீழே உட்கார முடியாதுன்னா okay, that is one problem. But நீங்க வெளியில போக முடியும், you can do everything, நடக்க முடியும், you can do everything that you love to do. You can take care of your grandkids, you can take care of your house, you can cook, you can do everything that you want to do. So it is, I don't think it is something. And hip replacement inna, the results are even better. Hip replacement panna keela ukkara mudiyum. You can almost jog, you can do half a marathon after hip replacement.
Life does not stop.
Life
if you
becomes
get
better.
That's what we like to hear.
Life becomes better, not because I'm an orthopedic surgeon, but that's the reality and that's a fact. There are many people who, many people who done well and who do well. And today with our technology, the pain has come down. The days that you don't have to go to work have reduced. So you're back in action very fast.
So you're not missing out on much. And the chinna pause.
So don't worry about it. Take some time, think about it, but you find nalla varum. It'll be good. You'll be happy. Whoever thinks about it, they will be happy.
Now you've explained so much that I feel like the next question might be an oversimplification. But knee replacement அப்படின்ற ஒரு டைட்டில் கேட்கும்போது we think of our knees being replaced. So like very much like, like a transplant. It's like, okay, my knee is not working. மத்தவங்க knee கொண்டு வந்து வைப்பாங்க. Or, same with the hip. Is that really the case, or have we misunderstood the entire topic?
It's a little bit of a misunderstanding.
Okay, tell us,
so
please.
What happens idhila enna panmona, நம்ம basically இது unga knee why do we change the knee? Because knee is arthritic. The cartilage is damaged, it's become rough. The only thing that we remove is the rough cartilage. And the cartilage வெளியில இந்த surface cut பண்ணி எடுத்துட்டு we put in artificial implants. What are the implants? They are made up of an alloy of titanium, and then there's a polyethylene liner which is highly cross-linked polyethylene, and they move against each other along with the base plate. So on both the bones, the shape of that bone is only put as a implant, and that is what is a knee. And other than that is balanced well. That அது இல்லாம everything is what your natural knee is. Ligaments அதெல்லாம் natural. knee வெளியில எடுத்து நம்ம போட்டு வேற knee எடுக்க போறது இல்ல. இது நம்ம only சின்ன layer எடுக்கிறோம். அந்த layer replace பண்ணிட்டு நம்ம artificial அந்த layer replace பண்ணி artificial implants போடுறோம்.
And hip replacement
also similar. cup இருக்கும், ஒரு head இருக்கும், cup, head, and the stem will go inside the bone. So என்ன ஆகும்னா hip replacement like cup rough ஆயிடும், head இருக்கும், that will get rough. So அந்த cup நம்ம வேற போடணும், head cut பண்ணி வேற head போடுறோம். That is hip replacement. Yes, the term is hip replacement, but the bone is not being taken out. Only little part of the bone is taken out. Whatever is the problematic part is taken out. Whereas that is why it is as natural as it can be and as best as it can be. Ligaments and all are just as they are.
Superb. Thank you so much for clearing that out, because எங்களோட மனசுல என்னமோ அது வந்து ரொம்ப ஒரு futuristic situation மாதிரி. I think that also adds to the fear
Yes.
that comes with
Yes,
you know,
yes.
a knee replacement. Now the last segment that I kind of spoke about earlier is something where we want to talk about the myths that surround the orthopedic world, because there's a lot of misinformation out there, and of course when we have an expert like you, we want to ask you all the
Sure.
questions. So I have a few myths, so please feel free to let us know either on the correct illa seriana information or don't really believe in it. For instance, when we are growing up, every time that we crack our knuckle, we say, oh my god, if you do that you'll get osteoporosis, or you're losing your you know, bone health, or you're making yourself weak. Is that right?
Nothing wrong in cracking a joint, but it's not something that you should keep doing, because some people get into that habit. It's not a good habit.
Okay.
It's not going to harm you, but it's not a good habit. See, what happens is when you crack a joint, those joints that are is basically the fluid inside the joint is giving you that cracking feeling. But you understand, when you do that, it's basically every joint is a smooth. Is the joint is smooth. So when you do that and then unnecessarily when
Friction
you crack
create
friction,
pandra
why to
madri?
create a friction unnecessarily?
Okay. So I mean, it's not bad, but
It's not bad, but
Don't know
if you
what
don't make it into a habit.
okay. Next question: women lose bone strength faster than men after 30. You already alluded to it, but
Yes, they do.
they do.
Yeah.
Okay, next question, I feel like we've already touched on, but heels or fashionable footwear does not damage your knees. That's just fake news.
Yes.
Is it?
Yes.
It does, or it does
It
not?
doesn't. It does. Heels. No, heels are fast. They do damage knee. They do damage your knees.
Damage your
Yes,
knees.
yes.
Okay. Joint pain after 40 is inevitable. It's part of aging.
No, it's not.
What?
No, 40? 40 is
40 is not aging.
If 40 is not aging, they're still young. They still have their entire life.
Okay.
The best part of their life to yet come.
Yet to come. All right, and final question. If you don't have any pain in your joints, you're perfectly healthy, please don't consult a doctor. Chill.
Yes.
Really?
If you don't have any pain in your joints, then why do you need to do anything?
So, I mean, no pain
Relax.
is just...
Yeah, no pain, don't do anything. Relax and work out. That's all.
I think that's what we're
That's
taking
the
away.
motto.
Because my final question was going to be that, you know what, before we conclude this episode, if I can request you to give us, you know, your closing remarks. But I think எங்க எல்லாருக்குமே உங்களோட closing remarks we can already preempt, which is exercise, and stay healthy.
Stay healthy, yes. And eat right.
And eat right. Fantastic. Thank you so much, doctor. That was
Thank you.
absolutely enlightening.
Thank you.
இன்னும் நிறைய interesting conversations காத்துட்டு இருக்கு. Don't forget to follow us on the JFW YouTube channel.